middle part of the Norma Basalis, this part lies just behind the posterior free border of the hard palate and in front of an imaginary line which passes through the anterior margin of foramen magnum. So this region is called as middle part of Norma Basalis. So this part we will learn by dividing into two parts again. So the part which is at the midline, this is called as the median area of the middle part of Norma Basalis, and the part lateral to it, this part is called as lateral area of middle part of Norma Basalis. So we will divide into two, median area and the lateral area. In the median area of the middle part of Norma Basalis, the first structure to be identified is the vomer. The posterior aspect of the vomer will be very clearly seen at this median area. So in this view, this is the vomer. The vomer is the bone which is mainly contributing for the formation of our nasal septum. So its posterior edge is very clearly seen here in the Norma Basalis. Here we can trace the vomer upwards and we can trace the vomer downwards. Below, the vomer is fusing with the posterior aspect of our palate, hard palate. Next part to be identified is the basilar part of occipital bone, or also called as basi-occiput. That is this sloping area. This is located just behind the vomer. Again, at this region above we have the body of sphenoid. Okay, so the body of sphenoid only is less portion we can appreciate here in this Norma Basalis. The two tiny canals like palatino-vaginal canal and vomero-vaginal canal, these are also seen at the area of this median part, but these two features I will explain you after explaining the pterygoid process and pterygoid plates. Another important fact to be learned is pharyngeal tubercle. So the pharyngeal tubercle is this midline bulging, downward bulging, that is from the basi-occiput. This pharyngeal tubercle is exactly at the roof region of the pharynx, and this is providing attachment to the median raphe of the pharynx. The details of this pharyngeal tubercle and its attachment we will learn under the chapter pharynx. The lateral part of this middle part of Norma Basalis shows several features when compared to the median area. So the lateral part of this middle part of Norma Basalis, first we have to identify the bones over here. This yellow colored part is the sphenoid bone, and here this red colored region is the temporal bone. And again we have the rest of the regions, like this is the inferior aspect of your zygomatic arch. Behind this is the occipital bone. So first, if you go through the details of this lateral part, first we have to identify the pterygoid process of the sphenoid bone. Remember, in the sphenoid bone there is a pterygoid process, and from the pterygoid process we have two plates hanging down. One is in the medial aspect, this is called as medial pterygoid plate. One is in the lateral aspect, that is called as lateral pterygoid plate. So to make you understand these two pterygoid plates, look at this particular diagram. So here lateral to the vomer we can see two plates are there. Okay, so this is the vomer, two plates are there, vertical plates. One is medially located, one is laterally located. So these two plates are called as medial pterygoid plate and lateral pterygoid plates respectively. And remember, these plates are hanging down from the pterygoid process of sphenoid bone. Anteriorly, these two plates are fusing each other, and posteriorly these two plates are far apart, and this depression between, or V-shaped depression between medial and lateral pterygoid plates, this is called as pterygoid fossa. Pterygoid fossa. And the part lateral to these pterygoid plates, this wide area, yellow colored part, is called as greater wing of sphenoid. That is the infratemporal surface of greater wing of sphenoid. Let us learn the features of pterygoid process and the pterygoid plates with the help of these diagrams. So identify the sphenoid bone. This is the body of sphenoid bone, and on either side these two parts are greater wings, greater wing of sphenoid bone, and above you have smaller wing that is called as lesser wing. And in this diagrammatic representation, this is the body of the sphenoid bone, and on either side this larger wing like part, this is called as greater wing of sphenoid bone, and above you have smaller wing like part, this is called as lesser wing. Remember, lesser wing of sphenoid we cannot appreciate from the Norma Basalis, but we can appreciate the undersurface or infratemporal surface of the greater wing of sphenoid, that is clearly seen in the Norma Basalis. And this part is the pterygoid process. It is very clear that from the pterygoid process you have two pterygoid plates hanging downwards. One is in the midline. This is called as medial pterygoid plate. One is in the lateral aspect. This is called as lateral pterygoid plate. So medial pterygoid plate medially and lateral pterygoid plate laterally. Remember, these medial and lateral pterygoid plates are fused anteriorly, and this fused portion laterally forms pterygomaxillary fissure. I will show you in another picture. That is the communication between infratemporal fossa and pterygopalatine fossa, pterygomaxillary fissure between these pterygoid plates and anteriorly the body of maxilla. And remember, posteriorly these medial and lateral pterygoid plates are wide apart, and in between these two plates you have a V-shaped sulcus. This is called as pterygoid fossa. It's called as pterygoid fossa. Remember, again, if you consider the details of medial pterygoid and lateral pterygoid plates, the medial pterygoid plates inferiorly that will form the pterygoid hamulus. So that is a hook-like or turned portion of the lower margin of the medial pterygoid plate. And remember, this is called as pterygoid hamulus. This pterygoid hamulus is connected to the mandible by pterygomandibular raphe. And remember, this hook-like part, that is the pterygoid hamulus, is related to the tendon of tensor villi palatini. The tensor villi palatini tendon will hook around this pterygoid hamulus, and that will become horizontal in order to get attached to the soft palate. These details we will learn when we are learning the soft palate. So that is pterygoid hamulus. But remember, again, the posterior free margin of this pterygoid process, this part, if you trace upwards, this will split into two in order to enclose a very small triangular depression. That very small triangular depression in the upper part of posterior free border of medial pterygoid plate is called as scaphoid fossa. So it is very clear, scaphoid fossa. This side, this is the scaphoid fossa. How to trace this scaphoid fossa? So trace the posterior free margin of medial pterygoid plate upwards. In its upper part, it is split into two to enclose this small depression called as scaphoid fossa. Remember, these pterygoid plates, its surfaces and these fossae, these are all providing attachment to certain muscles, especially the muscles of infratemporal surface. So that we will learn in the respective topics. Remember, the surfaces of these pterygoid plates, we have medial surface and lateral surface. Here in this picture, medial surface and lateral surface respectively. For the lateral pterygoid plate also, we got the medial surface directed medially and lateral surface. So the medial surface of lateral pterygoid plate, that is forming this scaphoid fossa, and the lateral surface will be forming the boundary for our infratemporal fossa that we will learn later. So these are the two pterygoid plates, medial pterygoid plate and lateral pterygoid plate respectively. Next, let us understand two tiny canals which are located very close to the median area of this Norma Basalis. Remember, these are the vomerovaginal canal and palatinovaginal canals. To understand the exact location and orientation of these two canals, we should be with a very clear-cut idea about the bony architecture of this particular region. Here you have to expect the vomer, and again you have to expect the horizontal plate of palatine bone, and you have to find out where actually the two pterygoid plates are, the medial pterygoid plate and lateral pterygoid plate. Remember, the vomer, that is forming the nasal septum. If you trace the vomer upwards, this vomer is dividing into two ala. Okay, this is the ala of the vomer, and again this is the ala of vomer. And again, if you trace the palatine bone here, this is the horizontal plate of palatine bone. This is forming the posterior aspect of your hard palate. This horizontal plate is turning upwards to form the perpendicular plate of palatine bone. And remember, the upper part of this perpendicular plate, that will form the sphenoidal process, because very next to this you have the sphenoid bone, greater wing of sphenoid and pterygoid process of sphenoid. So this is the sphenoid process. So I will repeat, this is the vomer, and if you trace it upwards, it will continue as ala of the vomer. And again, this is the horizontal plate of palatine bone. It will turn upwards, and that will form the perpendicular plate, and again that will continue as sphenoidal process. But remember, this perpendicular plate of palatine bone and the medial pterygoid process will be fused. Okay, so these two are existing together. Again, now you have to understand, this is the pterygoid process. That means from the greater wing of sphenoid, you have another process here. This is called as vaginal process. Remember, this vaginal process or the vaginal plate, that is existing or that is passing between the ala of vomer above and the sphenoidal process of palatine bone below. So if you observe very clearly, in between these processes, you have canals. These are vomerovaginal canal and palatinovaginal canal respectively. So in a vertical line, first you identify three structures. Uppermost one, ala of the vomer. Just beneath that, vaginal process of sphenoid. Again, just beneath that, you have sphenoidal process of palatine bone. So the space between the ala of vomer and the vaginal process, this is called as vomerovaginal canal. Again, the space between the sphenoidal process of palatine bone and the vaginal process below, this is called as palatinovaginal canal. So remember, through this palatinovaginal canal, the vessels and nerves to the pharynx will pass. That is, the pharyngeal nerves and vessels will be passing through this canal. So here, this is the area of the nasopharynx. So these are coming from the pterygopalatine fossa. So that is the significance of this vomerovaginal canal and palatinovaginal canal. And this is a skull specimen. Here, first you identify the vomer. Remember, the vomer, if you trace it upwards, that is dividing into ala. Again, beneath here you have to expect the palatine process, that is the horizontal plate of palatine process, and this is the medial pterygoid plate and this is the lateral pterygoid plate. And remember, the perpendicular plate of this palatine process, palatine bone, that will be along with the medial pterygoid plate. And again, above you have the pterygoid process. You have to expect the vaginal process in this direction. And between the ala of vomer and vaginal process, that is the vomerovaginal canal, and beneath, between the vaginal process and the sphenoidal process, you have the palatinovaginal canal. So this is the area of vomerovaginal and palatinovaginal canal. The other features to be learned in the middle part of Norma Basalis, that is in the lateral area, let us analyze. So here you have the infratemporal surface of greater wing of sphenoid. So this is the infratemporal surface of the greater wing of sphenoid. Remember, here this infratemporal surface of greater wing of sphenoid forms shows almost 5 boundaries or 5 borders. So if you trace it one by one, this is the anterior border, and this is anterolateral border. Again, this is posterolateral border, and this is posteromedial border, and here will be the anteromedial border. So I will repeat the borders once more: anterior border, anterolateral border, and anteromedial border. And this is posteromedial border and posterolateral border respectively. Each borders are having specific features to be remembered. For an example, the anterior border is showing the forming the posterior limit or posterior boundary of inferior orbital fissure. So here will be the inferior orbital fissure. Its posterior boundary is found by the anterior border of this greater wing of sphenoid. And anterolaterally, this will form the infratemporal crust. So this bulging is called as infratemporal crust. And remember, posterolaterally, this border will fuse with the squamous part of temporal bone. So this is the squamous part of temporal bone. And again posteromedially, this part that will articulate with the petrous part of temporal bone. Remember few parts of temporal bone that is very clearly seen here. This is the squamous part, and this is the petrous part, and this is the mastoid part, and this is the tympanic plate and tympanic part of this temporal bone. So our boundaries, posteromedial boundary is the petrous part of temporal bone. The last boundary to be explained is anteromedial boundary. So this anteromedial boundary or the border that will fuse with our pterygoid process. So these are the 5 borders of infratemporal surface of greater wing of sphenoid. Remember the posteromedial margin of this inferior infratemporal surface of greater wing of sphenoid. This is very important because along this margin you can feel or you can see certain foramina, important foramina. The first foramen to be identified is an oval shaped foramen. This is called as foramen ovale. Foramen ovale. Through this foramen ovale there are 4 important structures mainly passing. That is the mandibular nerve that will enter from cranial cavity to the infratemporal fossa. Then you have accessory meningeal artery. Again lesser petrosal nerve and emissary veins. So when you are reading the textbook, you will read that male structures, M-A-L-E structures, that is mandibular nerve, accessory meningeal artery, again lesser petrosal nerve and emissary vein. These are the structures which are passing through this oval foramen that will be located along the posteromedial margin. Exactly, if you want to explain the location of this foramen ovale, you can say posteromedial aspect of upper border of this lateral pterygoid plate. So this is the lateral pterygoid plate, its posterior free border. In its upper aspect, posterolaterally. So that is the position of foramen ovale. Just lateral to foramen ovale, you can expect another tiny foramen that is called as foramen spinosum, through which the middle meningeal artery will enter to the cranial cavity from infratemporal fossa. Remember these structures we will learn under the topic infratemporal fossa. So infratemporal fossa we will detail later. So these structures are the structures of infratemporal fossa. Middle meningeal artery is the artery, that is a branch of the maxillary artery that will enter through this foramen spinosum. And along with that you have meningeal branch of mandibular nerve. So that also will enter. That is also called as nervus spinosus. So that nerve also will pass through this foramen spinosum. Remember just lateral to that, at the junction between the posteromedial margin and the posterolateral margin, almost here you have to expect another tiny downward projection that is called as spine of sphenoid. This spine of sphenoid is providing attachment to a ligament called as sphenomandibular ligament. Its tip is providing attachment to a ligament called as sphenomandibular ligament. Again, the rest of the features to be learned here is sulcus tubae. Sulcus tubae. Sulcus tubae is located at the junction between the posteromedial margin of infratemporal surface of greater wing of sphenoid and petrous part of temporal bone. So this is the junction. At this junction you can expect a tiny sulcus, a depression. So this is called as sulcus tubae because this sulcus or depression is lodging the cartilaginous part of eustachian tube. So here you have to expect the nasopharynx, and almost here you have to expect the middle ear cavity. So the nasopharynx and middle ear cavity is connected by a tube, tubular passage, that is called as pharyngotympanic tube or eustachian tube or auditory tube. So its bony part is located laterally, cartilaginous part is located medially. So these details we will learn under the chapter ear. But remember that cartilaginous part is located here in this sulcus tubae. So where are you supposed to trace this sulcus tubae? Sulcus tubae is located along the posteromedial margin of the greater wing of sphenoid here in the Norma Basalis at its junction with the petrous part of temporal bone, that is sulcus tubae. Next is carotid canal. Remember, if you analyze the petrous part of temporal bone here, This petrous part of temporal bone is triangular in outline. So this is its base laterally and this is its apex medially. So remember, at the base region you have carotid canal through which the internal carotid artery will enter. Again, its apex region will show the foramen lacerum. So the details of this carotid canal and the foramen lacerum I will explain you in the next slide shortly. This is the picture to explain you how exactly the carotid canal and foramen lacerum is existing in the Norma Basalis. Remember, at the base region or in the lateral aspect of this Norma Basalis, this is the location of this carotid canal. So this carotid canal through which the internal carotid artery along with the nerve plexus and the venous plexus, the sympathetic plexus, that will enter, the internal carotid artery will enter to the carotid canal. This carotid canal got a curved course here within the skull. And remember, the medial aspect of this petrous part of temporal bone, that will show another opening here. This is called as foramen lacerum. Remember, this foramen lacerum will be usually closed. This will be usually closed by a cartilage. Remember, again at the upper aspect of this foramen lacerum, our carotid canal, so that means our carotid canal will continue. So the internal carotid artery is continuing here. So this is the orientation of this carotid canal and foramen lacerum. So this foramen lacerum, if you analyze, so this is very close to the apex of this petrous part of temporal bone. And this is the picture to show you how exactly the eustachian tube or pharyngotympanic tube is existing. So the ear got the external ear, the middle ear cavity and the internal ear. Remember, our middle ear cavity is connected to the pharynx, nasopharynx, through this tube. This is called as pharyngotympanic tube or eustachian tube. Its medial part is cartilaginous and the lateral part is bony. So this cartilaginous part of the eustachian tube, that is lodged in the sulcus tubae. This sulcus tubae is one of the important features of the Norma Basalis, that is the middle part of Norma Basalis. So to have a review of this middle part of Norma Basalis, we have seen already the median area. Here we were talking about the vomer and we were talking about the basi occiput and the pharyngeal tubercle. And then we were entering to the lateral part. In the lateral part we have seen the pterygoid process with the two pterygoid plates, the medial pterygoid plate and the lateral pterygoid plate respectively. And in between medial and lateral pterygoid plate we have seen the pterygoid fossa here. And remember, from the medial pterygoid plate, from its lower aspect, we have the pterygoid hamulus. And the upper part of this posterior free border of this medial pterygoid plate, that will split to enclose the scaphoid fossa. Then we have to learn the further details. So still more laterally we have the infratemporal surface of greater wing of sphenoid. And again here you have the squamous part of temporal bone, and this is the area of petrous part of temporal bone. Further we will learn another part called as tympanic plate of the temporal bone. And here I would like to show you the anterior margin of the infratemporal surface of greater wing of sphenoid, that is clearly forming the posterior boundary of inferior orbital fissure, and anterolaterally the infratemporal crust, and posterolaterally here this is fusing with the squamous part of temporal bone, and posteromedially this is the area where this infratemporal surface of greater wing of sphenoid is fusing with the petrous part of temporal bone. At this area you have the foramen ovale and also the foramen spinosum here. Next to expect is our carotid canal here. This carotid canal is the passage for the internal carotid artery, and further at the apex of this petrous part here you have the foramen lacerum. Usually it may not be pattern, that will be closed by the cartilage. Remember, next is our tympanic plate. So this is the area of the tympanic plate, and in this tympanic plate you have to expect this one, squamo-tympanic fissure. So that is between the squamous part and the tympanic plate. This is squamo-tympanic fissure. And I will show you in another picture from above downwards, tegment tympani, a vertical process that will be hanging down, tegment tympani. This tegment tympani that will divide this squamotympanic fissure into two, petrotympanic and petrosquamous fissure respectively. So that I will explain you in another picture. So before that, you have to identify where exactly the squamous part of the temporal bone is. In the squamous part, you identify a depression. This is called as mandibular fossa. This mandibular fossa is lodged in the head of the mandible and forms an important joint, that is temporomandibular joint. Remember, anteriorly you can see the anterior root of zygomatic arch, and on side you have to identify the posterior root of zygomatic arch or zygoma. This anterior root and posterior root meets from that meeting junction you have the articular tubercle. So these points you have to identify at the squamous part of temporal bone. Petrosquamous fissure and petrotympanic fissure. So I would like to explain you these two parts with this illustration. So before that, you identify the area of the squamous part of the temporal bone and tympanic plate. So remember, in between this squamous part of temporal bone and the tympanic plate, so this part you can call as squamotympanic fissure. So in this illustration, this is the area of squamotympanic fissure, that is between squamous part of temporal bone and tympanic plate of temporal bone. What is happening? A vertical process that is called as tegment tympani that will come from above downwards. So that means downturned part of this tegment tympani that will enter to this fissure called as squamotympanic fissure, and this will divide this entire fissure into two parts. One is in the anterior aspect, one is in the posterior aspect. The one which is in the anterior aspect is called as petrosquamous fissure, between the petrous part of temporal bone and squamous part of temporal bone. This is petrosquamous fissure. The part which is behind or in the posterior aspect is called as petrotympanic, between the petrous part of temporal bone and the tympanic plate of temporal bone. Because this is called as petro, because this is from the petrous part of temporal bone, that is called as tegment tympani. So tegment tympani is a part of petrous part of temporal bone. So that is why petrosquamous fissure and petrotympanic fissure. Remember, through this petrotympanic fissure, the cauda tympani nerve, there is a branch of facial nerve that will come downwards, that will emerge out downwards.